Have you ever wondered why doctors always insist on checking your blood pressure during visits? Well, it's not just a routine process. Monitoring blood pressure is like taking a sneak peek into the overall health of your body. It's an essential indicator that can reveal potential health risks that may be lurking beneath the surface. High blood pressure, for instance, can lead to serious complications if left unchecked. It's often dubbed as the silent killer, and for good reason. It can stealthily cause damage without manifesting noticeable symptoms, leading to heart disease, stroke, and even kidney failure. Even if you seem healthy and feel perfectly fine, it's critical to keep an eye on your blood pressure. It's about staying one step ahead, being proactive rather than reactive when it comes to your health. So, it's clear that keeping an eye on your blood pressure can be a lifesaver. It's not just about numbers on a screen, but about understanding what's happening inside your body. Now imagine having a personal health assistant that helps you track your blood pressure. This is where a blood pressure logbook comes in. What's a blood pressure logbook, you ask? Well, it's a simple yet powerful tool that allows you to keep a record of your blood pressure readings over time. Similar to a journal, it's a place where you can jot down your daily blood pressure measurements, but it's more than just a collection of numbers. Each entry tells a story about your cardiovascular health, providing you with a comprehensive overview of your blood pressure patterns. This information is invaluable, especially when it comes to managing conditions like hypertension. With a blood pressure logbook, you're not just tracking numbers, you're mapping out your journey towards better heart health. This tool offers you a clear picture of how your lifestyle choices, medication, and stress levels impact your blood pressure. Think of it as a health diary dedicated solely to your blood pressure. You might be wondering, how exactly do I use a blood pressure logbook? Well, let's dive right into it. First things first, you'll need a blood pressure monitor. There are plenty available in the market, so choose one that suits your needs and budget. Once you have your monitor, it's time to start logging. Step 1. Take your blood pressure reading. Make sure you're relaxed and seated comfortably. Place the cuff on your upper arm, following the instructions that come with your monitor. Press the start button, and wait for the machine to do its magic. Step 2. Record your reading in the logbook. Write down the systolic and diastolic numbers, which are the top and bottom numbers on your monitor's display. The systolic number measures the pressure in your arteries when your heart beats, and the diastolic number measures the pressure in your arteries when your heart rests between beats. For example, if your reading is 120/80, you would write 120/80. Step 3. Note the date and time of each reading. This detail is essential as blood pressure can fluctuate throughout the day. Typically, it's lowest when you wake up and may rise throughout the day. Step 4. It's also a good idea to jot down any factors that may have influenced your reading, like stress, diet, exercise, or medication. These notes can help you and your healthcare provider identify any patterns or trends. As for when and how often to take your readings, that's something you should discuss with your healthcare provider. As a general rule, it's usually recommended to take readings at the same times each day, such as morning and evening. Remember, consistency is key. Make it a daily habit to take and log your readings. Over time, this logbook will provide valuable information about your blood pressure patterns, which can assist your healthcare provider in managing your health more effectively. And there you have it, it's as simple as that. So you've got your readings, but what do they mean? Let's break it down. When you take your blood pressure, you'll see two numbers. The top number is your systolic pressure, which measures the force your heart exerts on the walls of your arteries each time it beats. The bottom number is your diastolic pressure, measuring the force your heart exerts on the walls of your arteries in between beats. Alright, but how do we interpret these numbers? Well, a normal blood pressure reading is typically around 120/80, often written as 120/80ths. This means your heart is exerting a moderate amount of force on your arteries, both when it beats and when it's at rest. However, if your blood pressure is consistently above 120/80, you may be in a stage called pre-hypertension. This is a sort of warning stage, a nudge from your body saying, hey, let's pay a little more attention to our heart health. Now, if your readings consistently show a systolic pressure above 130 or a diastolic pressure above 80, you may have hypertension, commonly known as high blood pressure. This means your heart is working too hard, putting too much force on your arteries, and it's time to seek medical advice. On the other hand, if your blood pressure is consistently below 90/60, you may have low blood pressure, also known as hypotension. This could indicate that your heart isn't exerting enough force on your arteries, which can also lead to health issues. So, understanding your blood pressure readings is like learning to speak a new language, the language of your body. It's about noticing patterns, interpreting numbers, and knowing when it's time to seek help. It's important to remember that everyone is different, and what's normal for one person might not be normal for another. Regular checkups with your doctor are crucial to understanding your individual health. Remember, knowledge is power, especially when it comes to your health. So why go through the hassle of using a blood pressure logbook? Well, picture this. You've been monitoring your blood pressure regularly, but all those numbers are just floating around. Where do they go? How do you make sense of them? Enter the blood pressure logbook, your personal health diary. Firstly, a blood pressure logbook aids in health monitoring. By keeping track of your readings, you create a comprehensive record of your blood pressure over time. This allows you to spot trends and patterns that might otherwise go unnoticed. For instance, you might realize that your blood pressure tends to spike in the mornings or after a stressful day at work. Recognizing these patterns gives you the opportunity to make proactive changes to your lifestyle or habits before they escalate into serious health issues. Secondly, a blood pressure logbook facilitates communication with healthcare providers. When you visit your doctor, you'll have a detailed history of your blood pressure at your fingertips. This can be incredibly helpful in guiding your healthcare management plan. Your doctor can use this data to assess the effectiveness of your current treatment, adjust your medications, or recommend lifestyle modifications. This way, your logbook acts as a bridge between you and your healthcare provider, ensuring that you receive the most appropriate care for your individual health needs. Lastly, a blood pressure logbook promotes self-awareness about one's health. By taking an active role in logging your readings, you're not just jotting down numbers, but you're also learning about your body, how it reacts to different situations, and what it needs to stay healthy. This heightened sense of self-awareness can motivate you to make healthier choices like eating a balanced diet, exercising regularly, or managing stress effectively. So as you can see, a blood pressure logbook is a small tool with big benefits for your health. It's more than just a book. It's a roadmap to better health, a communication tool, and a mirror reflecting your body's needs. So why not give it a try? Start tracking your blood pressure today and take control of your health journey. So, as you can see, a blood pressure logbook is a small tool with big benefits for your health. There are many blood pressure logbooks available in bookstores and online. If you would prefer to purchase mine, it is available on Amazon. Please type B0BYBC8X5W in the Amazon search bar, and you will be presented with my book for purchase. If you find this video helpful, please share with your friends and family. Please like and subscribe for upcoming health-related videos.